Welcome back to the second episode of our podcast. Today we're excited to have some new voices. I guess technically since it's the second day, you don't know it's new, but it's still new.
New to us.
New to us, exactly right.
Yeah.
So it's me. I'm Dr. Walia. I'm the comprehensive ophthalmologist here at West Coast Eye Institute, and I'm always joined with my great teammate. And go ahead if you want to introduce yourself.
Julia Castillo. I'm the COO for West Coast Eye Institute.
And we have another teammate sitting to my right, and you want to say hi to everybody?
Yes. Hello. My name is Jissel, and I am a tech here at West Coast Eye Institute.
And Giselle might sound like she's on like a euphoric high right now, because today, Giselle, how long have you been here at West Coast?
I want to say about 4 months.
4 months.
4 months.
And did you do anything different today or anything like that?
I did.
What did you do today?
I scrubbed into surgery.
So, Giselle is a great teammate that's been here in the clinic and seen patient care. And today was kind of your first real realm of the surgical world.
Yes.
What do you think?
It's very different.
Your emphasis on the yes really highlights the smile. I mean, your team, nobody could see it, but that was a long yes.
They might not have seen it, but they can feel it.
You can feel it. We all felt that.
You felt that.
It was very different. I didn't expect to do this today, so I'm always in for an adventure here.
That's a good way to describe right there, Giselle. Like, what a good segue there. Giselle's our resident youth for the episode. So,
as opposed to the non-youth, that's how you
listen, Julia. I call it like it is. Okay. I mean, I learned what is it? Musbark? What is the term? That we eat food on a podcast.
Mukbang.
Mukbang. Yeah. Mukbang. Yeah, exactly.
What?
You didn't know this term?
No.
This is why I said Giselle is our resident youth for this podcast here. So I thought it would be a good conversation today as we have a little bit of fun in the eye clinic to get to hear how three of us, all in different tiers of our eye experience, would describe glaucoma. Right? I think glaucoma is a disease that we all see all the time. Giselle, probably you've mentioned you've been here for 4 months. How often do you think you've seen glaucoma?
Every day.
Every day. Does it haunt your nightmares right now?
No.
No, not yet?
It doesn't, no.
Okay.
At first it did, but...
And you get the nightmares are gone?
Yeah, they're gone.
Okay.
They are gone.
That's a good thing.
Yeah. And so, for a patient, when you come into West Coast, it's always kind of a whole experience, right? I think you get to learn about the eye literally from the first technician you meet to the imaging specialist and then down to hopefully your provider. So all of us kind of have a job to explain this to us. So maybe for people listening in, Giselle, how would you, if you had to define or describe glaucoma to somebody who's never heard us before, how would you tell them what glaucoma is?
Glaucoma is a disease that applies pressure to the optic nerve.
I noticed the S was no longer there on that yes. Giselle got very serious very fast, didn't she?
Yeah.
Okay. I like that definition. I think there's probably a few things I'd add to that definition or maybe kind of help highlight for patients. Now, Julia, who's been in the eye world for a really long time, but has seen many different facets. I mean, Julia has a background, you were in the optical area with glasses, and then you've seen us grow and been a part of research and all that stuff.
Right.
Do you want to give your shot at what you would define as a definition or maybe a way to describe what glaucoma is to a patient?
Well, I think that I would agree with what Giselle's saying, but I did want to kind of add, when I started in ophthalmology, glaucoma was one of those things where it was like taboo. And when you heard glaucoma, when I was an optician, patients were just so scared because they were like, I'm going to go blind. That's it. I'm going to go blind. I have glaucoma. And that was 20 something years ago. So now when I hear glaucoma, I'm like, oh, you're going to be okay. We're going to be able to help you. It's not going to, I don't want to say it's not going to be a big deal, but it's so different than it was 25 years ago. Yeah. So when I hear glaucoma now, I'm like, okay, we're able to help you now. Whereas, again, 25 years ago was a whole different matter.
I mean, I think evolution just from ophthalmology in general, probably medicine, right? Like big scary words like cancer, tumors.
Right.
You used to have a stigma. Mm-hmm. Now it doesn't. Like when you say cancer, I mean, we all know somebody that's had a cancer at this point, right? I feel like Giselle, well, you're still not as old as Julia and myself. Right, like so. This is the world you grew up in, but realistically, right? I feel like when I was a young person, when you said cancer, like, oh my gosh, I'm sorry, that's it.
Yeah.
Now it's like, oh well, my uncle had cancer, and this is his story, and he's doing okay. It's kind of the same thing with glaucoma.
Right.
Would you venture into maybe if you're at a dinner table or maybe hypothetically a podcast with two other people, how would you describe glaucoma or maybe define it for a patient? Do you have any working definition? If somebody met you on the street and says, hey, you work at an eye doctor, what's glaucoma?
I would simply say it's just a disease of the eye. I mean, I don't think for me, I wouldn't go into it in depth because it's just not my nature to do that. But I would say, it's a disease of the eye, but you're going to be okay. We're going to be able to help you.
And I think that's you're right on those points for that one. I think it's a happy marriage between the two of you guys, right? I think what Jissel kind of mentioned and maybe how I would describe it for a patient is glaucoma is a very specific disease of the cord that connects the eye to the brain. It's called the optic nerve. So you actually have a really healthy eyeball and a really healthy brain, but the cord that connects the two, that's not healthy anymore. So I always like illustrations and visual examples like the TV. You have the TV, you have the power supply, you just never plug it in. TV doesn't work, right? I mean, everything's there. You just, for some reason, it's sending the cord, it's dead. Yeah. So the power cord is slowly dying in glaucoma. But Jissel used a word here. You said pressure. What made you think of pressure?
Because I know when patients come in and they have very high pressures, that means it's applying pressure onto the optic nerve, which is making the cord even more sick.
Jissel, you're on it, man. I tell you what, man, you got it. This lifting the curtain up behind the podcast here. Gisselle's had many firsts today, so this is her first podcast, her first day in surgery, and her first day ever eating hummus.
Yeah. Yes. So many firsts today. See, I'm telling you, every day.
Wow.
But rank them. Which one were the best first? Was it the hummus? Was it the podcast?
It's definitely not the hummus.
No.
I heard her talk about it earlier.
Yeah, hummus.
You didn't like the hummus?
No, hummus
Why
is
didn't
last.
you like it though? What about it?
I just don't like dips at all.
Whoa.
Yeah.
Who hurt you, Jissel?
Yeah.
No, I don't know.
Who doesn't like?
I don't know. That's just.
What about
I'm very
salsa?
picky. Barely.
Barely. That was a large gasp
can't.
of Julia. I mean, in my headphones, that
almost
sounded like a wave on Titanic. holy cow, Julia!
You don't like dips and you don't like salsa.
I can't.
I mean, which are one and the same, but still.
I can't.
Jesus.
I'm a picky eater. Very picky eater.
We know.
Oh.
Yeah.
This is
Just
why
letting you guys know.
This is This is why today's episode didn't go to a mukbang. See, you had to tie it all back together. See that, Julia?
Full circle.
But all right, so to piggyback on Jissel, and I like that answer, and I would say I would agree. When a patient comes in and they talk about glaucoma, I think we really highlight pressure, or maybe historically, right? When Julia used to talk about this as a disease in the past, that's all patient asks. Right?
High pressure. But I know that there are different parts of it that are not necessarily related to pressure.
Yeah, and so for us, when we think of it in the actual ophthalmic world, right, if you have a word in the definition, it's got to hold true at all time. It can't be kind of in there sometimes because that doesn't define the problem. So you can have glaucoma with normal pressures or something called low tension, normal tension glaucoma. Doesn't mean you don't have a problem. It just means you don't have pressure related to it. So I always like to equate it to a different organ system, right? We all know the heart and blood pressure. When you go to your primary care doctor, you might have high blood pressure. Well, who cares? I mean, I'm by no means am I a cardiologist or am I an internal medicine guy, but you treat the high blood pressure so you don't develop a problem. So eye pressure will worsen the actual problem of glaucoma. It doesn't create it, but it's the only controllable factor that we can try to hopefully reduce your risk for getting worse. So it's kind of a weird sentence, but think of it like, you have a great heart, but you have high blood pressure. I don't know how long that heart's going to be good for. So maybe we start to treat it now and the heart stays healthy. Does that make sense? Well, what if you have pretty good blood pressure, but you've had 3 heart attacks? Well, pretty good is no longer good enough. So the pressure is relative to your health. So for me, the definition of glaucoma is this is a progressive disease of the optic nerve in an eye that will limit the vision peripherally, then centrally. And pressure is the only risk factor that we can control. So we try to control pressure and we check the nerve every time you come in. So I think that's probably a good working definition. Maybe that helps some people listening to the podcast listening in. And I think that's probably a good way to kind of end today. We can have a conversation about glaucoma and learn a little bit about Gisselle's eating habits at the same time. Right?
Yeah.
You're speechless. Boy. I feel like
yeah.
I just feel attacked. I feel attacked. My first episode.
This is a place of love, Jissel. We only say highlight it with love, So thanks for listening in. We'll be excited to do the next one. A little bit of just another eye conversation and eye health with a little bit of fun. So hopefully you guys get to learn and enjoy. Thanks.
Yeah.
Thank you guys.
Thanks, Jissel, for joining us.
Thank you guys for having me.
Bye.
Bye.